Davids. I'm a professor here at Westminster College, and I am co-coordinating the series of events we're doing called I Am Psyched in conjunction with the American Psychological Association. So we appreciate everybody being here this afternoon. We're going to start the set of two events that we have this afternoon with the first CEU panel that we've scheduled. So the title of this is, where's my title? There we go. So From Margin to Center, Honoring the Experiences of Women of Color Practitioner and Advocates. And so we have four great individuals here this afternoon to talk with us a bit about the unique experience of women of color in the context of therapy. So first I'd like to introduce Dr. Shari Miles-Cohen, who is the Senior Director of the Women's Programs Office at the American Psychological Association. Dr. Miles-Cohen received her PhD in personality psychology from Howard University in Washington. We have Karen Tao here, who is an assistant professor in the Department of Educational Psychology. She has her PhD in counseling psychology from the University of Wisconsin-Madison. We have Dr. Lee New. Lee is in private practice, is a clinical psychologist, and received her PhD in clinical psychology from the University of Utah. And then last, we have Dr. Alicia Hoerner, who is a school psychologist and received her degree in educational psychology from the University of Utah as well. So thank you all very much for being here. I'm going to hand it over to Dr. Miles-Cohen, who's going to facilitate our discussion this afternoon.
So good afternoon, everyone. Please let me know if you can't hear me. We have two mics for four women, so we're going to try to share effectively this afternoon. And Chris has told me that here in Utah that you all are very informal, so we'll just address each other by first name. Is that okay? So I am really pleased to be here for this panel and would like to ask Karen, Alicia, and Lee to talk a little more specifically about your work and what piqued your interest in participating in this panel.
Hi, my name is Lee New. When I saw the title, I thought, I didn't get this when I was in school. I think this would be something that I would have appreciated if I was in school. So here I am.
I'm Alicia Hoerner. Oh, this one is not. Let's see.
Yep, it was on.
Okay. Can you hear me? Okay. Where do I start? I'm Alicia. I'm originally from Lima, Peru. And I think it's taken me a few decades to recreate my identity as a woman of color. And so I am really appreciative of the opportunity to be here and self-reflect and my identity and who I am. I've lived in Salt Lake for 30 years almost. I cannot believe it. But I like to share some of my early experiences growing up in Peru.
Good afternoon, everyone. I'm Karen Tao, and I, as Chris mentioned, am faculty at the University of Utah in counseling psychology. I think the term women of color in general has always been intriguing to me. It's not something that I identified with from birth, or a girl of color for that matter, and it's similar to Alicia. I think about kind of what it means to be a woman of color in different spaces. It seems more salient than ever since moving to Utah 6 years ago, and it's something I just think a lot about as not just a psychologist, but as a mom, as a friend, as a daughter. And so even today when my parents just came from Hawaii, they're visiting, and I told them about this panel, and it just kind of blew my mind. My mom said, "What's a woman of color?" And it just struck me that it's an identity that I hold very dearly and sacredly, and yet my mom doesn't know what it means. And so I entered this space today sort of with that on my mind.
Thank you. So as you think about a woman of color entering therapy, can you talk a little bit about sort of what her needs may be as compared to women in other groups?
Well, I'm trying to think of the women of color that I currently have on my caseload. I guess in some ways they're not so different because, you know, as women, we deal with many of the same issues, you know, whether you're, you know, whatever color you are. But as I reflect on the way when I was looking for somebody to, when I was seeking to be a patient and wanting to be in therapy, I couldn't find anybody really that was a woman of color, and so I guess it matters because for me, I was looking for somebody who I felt I could identify with and that I could kind of say things and not have to explain too much without without feeling like I am without having to explain too much, basically. So when I do see somebody who is a woman of color, I tend to, you know, actually there's another question that you're going to ask, you know, how much do you tend to share? And generally I don't share very much with most of my clients. I do not share very much personal information, but I do tend to share a little bit more when it is a woman of color. And I find that I feel like it's a little bit, like I want to empower them more by giving them my experience or sharing them with them my experience so that they don't feel so alone. Because I do get the sense that they feel as if nobody understands them, like or not very many people understand them, and so I try to share with them my own experiences so that they don't feel so alone.
I was originally trained as a school psychologist, but I became licensed after a few years of practicing in the schools, and I'm still practicing in the schools, so that's kind of my part-time job, and I mostly do evaluations and also some therapy. And something that I think is still interesting is that as I became trained, faculty and even peers started perceiving me as I could only practice with women of color or individuals of color and not with other groups, and that stereotype continues. So because I am a woman of color, I can only work with individuals such as myself, and that is very annoying and to me, and I try to fight it, and I think through the years I've developed, you know, more courage to be able to say, why do you keep thinking that I'm only trained to work with diverse populations? And just, let's see, I think it was Monday, I got a call from a parent, and he wanted a quick evaluation of his child who had been denied access to the gifted program in one of the school districts. And then he left me a message, and I returned the call, and then, you know, he could hear my accent. And he said, you know, I'm going to be very honest with you, but I don't think I will feel comfortable. I mean, no, please don't take it the wrong way, but I think I'm going to call another psychologist because I can hear that you have an accent, and I don't know if you're going to be able to capture my student. And this happens frequently, keeps happening, with people, you know, making attributions to my skills based on my accent, which I cannot shed. Having said that, very quickly, the women, and I think it's mostly women, the clients that I have, many of them have been sexually abused. And I wanted to share, I brought some statistics from Peru. You know, throughout the years, I've been more and less connected with my native country, but I am shocked to find out that Peru has the highest rates in South America. I'm not sure about Mexico, for violence against women. And femicides, I mean, the numbers are just staggering, like about 150 a year, and about perpetrators are not prosecuted or sentenced. There was one fact that I guess last year there were about about 800, in the last 6 years, about 800 attempts or completed femicides, and only 82 of those were prosecuted. So that has really made me feel that I need to be more of an advocate of women and be a better ear for women. And when I grew up in Peru, my father was a wonderful man, but his legacy was also of, raising us in a very authoritarian way. And I think that there was a lot of emotional abuse in my home, and I grew up in that environment. And I felt that education probably was my only way out, the only way that I had to protect myself. And from early on, it's like, oh yeah, I'm going to college. I'm not stopping. I came from Peru here to pursue my graduate education because I think deep inside of me, I felt that the only way that I could, find a way to protect myself from what I had witnessed from men was to get an education.
Some of the concepts that come to mind for me when I think about women of color in therapy are malleability and intersectionality, and just this, and some of this I also caution myself from thinking in that way around not essentializing women of color and saying all women of color have gone through the same experiences. And as Alicia and Lee have just shared, we've all had our own personal experiences. But some of the things I think a lot about are how women of color in particular have to shift who they are in different contexts. And in some ways, I think about how that can be pathologized, and it is often pathologized. So who are you anyway? You're this way with so-and-so and this way with other folks. And I think in sort of Western thinking, there's a sort of core self that you are who you are wherever you go, and that you bring, your whole self everywhere. And I think for women of color, that part of our resilience and resolve has been that ability to shift based on relationships, and it can be gender related, it can be age related, it can be race and ethnicity related. And so I think a lot about those things when I have women of color clients and when I work with students. And part of my work is really to hear their narratives around what's brought you here, and tell me your story. And living in Utah, one of the things I was mentioning earlier when I first moved here, I would see a woman of color and I want to be your friend, and immediately, gravitate toward other women of color, and realized just how different our stories around coming here are. And even within just the short time, you can hear those narratives.
So I know we were talking about sort of what sorts of things women of color bring to therapy, but I'm wondering if you were to advise a woman of color on finding a therapist, what sort of advice would you give her? What sorts of questions to ask? What sorts of qualifications to look for? Lee, what do you think?
I guess I would say the same thing to all women. Find somebody that you're comfortable with, somebody that, that you feel understands you or can understand you, and listens to you, and I don't know. I don't know if that would, for me, change much whether it's a woman of color or not. But I think that you're comfortable with them.
The clients that I have worked with didn't come initially for therapy. They were, I saw them initially for an evaluation. I do a lot of immigration evaluations where clients are seeking an immigration pardon. And in sharing their stories, then they even hesitate to ask if I think they should be they should receive some therapy. They should participate in therapy with hesitation and fear because they have never shared their stories before. And many of them, when they disclose traumatic events, they tell me, nobody knows about this. You're the first person I've ever told. So to me, it goes back even, to help them, support them so that they feel comfortable disclosing their life stories.
So one of the things that I do is I actually sometimes write out a list of questions for women of color or folks with minoritized statuses to ask a therapist over the phone. And first I say, trust your intuition. If you're not connecting over the phone, trust your intuition and move on. That you're entitled to work with someone who gets you. And so some of those questions can be, I'm a woman of color. If that's something that's salient to this particular person, to say, I'm a woman of color, how do you work with folks with minoritized statuses? This is important to me, and can you tell me a little bit about kind of your experience and background? I think being straightforward like that is important for clients to have that, their right to ask those kinds of questions. Some of the things in more of my, like when I talk with students who are looking for a therapist, grad school is hard and it's stressful, and so a lot of my students of color will ask for recommendations around therapists. And some of the conversations we have around that is, so therapy is a white space. So it's just how we've been trained, and even as a woman of color, I know I've been trained through a white lens. And so, and that's just sort of the reality. And I think trying to advocate and support folks who are seeking therapy to recognize that, and to sort of, and of course there are folks in the community that have great reputations, and so I'll definitely say, go and see so-and-so. And so once we learn our community and our network, to not be afraid to say, this person I think is the right person for you and is going to get you on all the levels that I think you want to be got. So.
Thank you. And what sorts of structural barriers do you think might be in place to prevent women of color to seek therapy?
I think, Karen made a really good point. Therapy is a white space. There is, so I think, and and your comment about, your mom, what's a woman of color, and I think that, I was trained here at the University of Utah in the clinical department, and I also grew up in Salt Lake City. I've been here since I was 6 years old. I was born in Vietnam, but I immigrated, or I was a refugee who came here with my siblings when I was 6 years old. And so I think growing up, I'm also not Mormon. So growing up, I didn't really know whether my being marginalized was because I was Mormon or because I'm Asian. I didn't really know, and there weren't that many of us around. Kind of a funny, when I was growing up, and we'd be driving down the highway, and I'd see another Asian. I said, "Oh, whoa! There's another one. There's another one of us here." I mean, I think it's different here than it was when I was growing up, almost 40 years ago. So it was quite different. And so what barriers are there? There's, I didn't know what psychology was. I didn't know that there were therapists. I didn't know anything like this growing up, and I think that even now, if I talk to my family about therapy, they think that I only see those who are psychotic or those who are really, really sick. They don't know that I see people who are just, depressed and have anxiety or, have just gone through some trauma. They don't, I think, even my own family, they have a sister who is a clinical psychologist. They don't know what I do. And so I would think that the majority of the population that wouldn't know, because I think that it is quite, it's quite foreign, I think. The idea of therapy is quite foreign, and if you are in therapy, it's because you're really, really, really sick.
Unfortunately, there's very many barriers at many levels, starting with the ability to pay for therapy, the ability to accept that you may need some help, the ability to find somebody that you feel comfortable with, ability to accept that you may need some help. So a lot of my clients also feel uncomfortable for the stigma of possible mental illness, and they discontinue therapy fairly quickly once they start feeling a little better. Trust is a big issue. I think if they feel they can trust you, they continue, they refer other clients, and they continue attending. But I think the thread, with Karen and Lee and myself, our mothers, adorable, but that my mom, I don't see her, she lives in Lima. And now tell me again, what do you do? Sorry that I'm asking you, but what do you do? So it's hard to capture for them. My mom is 78, what psychology is, how you help people with that, and understanding what mental illness can be.
Can you ask that question again? Just
Sorry.
Oh, structural barriers. Okay.
Yeah,
The barriers.
structural barriers,
Okay.
right.
The I Am Psyched exhibit, I think, really captures some of the barriers around just in psychology. I mean, racism is a barrier for folks of color seeking therapy, seeking counseling. There's just a long history of suspicion, and rightfully so, and skepticism around what psychologists do and what therapists do. And so I think that stigmatization piece is a huge barrier. And I mean, there's lots of literature and research out there that shows that in terms of access and quality of care for communities of color, it's the quality and access is much lower, and when compared to white clients. And I don't know if you all saw that recent study where they did this experiment where these were kind of Confederate clients who called therapists and left a message saying, I'd like to seek services. And they just did really minor manipulations with name and with accents, and found that potential clients of color were not called back, something like twice as much as sort of your white middle class client. And so, I mean, that was just a call to our profession that even before folks are even seen, just getting a call, just calling for an intake, the barriers are already there, not being called back. And so I think at all levels, yeah.
So I'll just follow up with you with an example. So I live in Washington, D.C. The city's divided into 8 wards. The majority of the sort of most marginalized communities live in Ward 7 and 8. And just recently, all of the hospitals all of the labor and delivery wards in hospitals east of the midline closed. Like there are no more labor and delivery wards on the east side of DC. So they're all on the west side where the wealthiest people live. So that means that a poor woman is going to have to catch a bus or find some way to get to the hospital to deliver her baby. She's probably not going to get prenatal care on a regular basis because the providers are too far away. And so when you all think about sort of providing behavioral health services to folks, and like the decision of where you put your office and what your hours are and things like that, can you talk a little bit about sort of how you make those decisions and if it's impacted based on the clientele you serve?
Absolutely. So I have a practice on the west side, and for those of you who are from here, the west side is where I think there are more minority, more people of color. And I chose a location. So my office is in a primary care building. So I think because of the stigmatization of mental health, I really wanted to be in an area where they're not just going to an office to see a psychologist, and so they're going to see a doctor. And so in the facility, there's primary care, there's a foot doctor, there's a pain doctor, there's me. So that was really important to me. The second thing that was, when I was setting up my practice, I talked to a lot of other psychologists about, how they set up their practice, and a lot of the psychologists recommended that I don't accept insurance, that I do just self-pay, and for me that was. I just couldn't do that. I think because self-pay is, I could do sliding scale, but even for sliding scale, I think for some folks it's just too much for them to pay. And so for me, I made the decision to accept insurance so that I could see a variety of clients. I could see those who could afford to pay self-pay, but also those who can't. So I made those decisions, and now with all the changes in the healthcare, sometimes I'm like, oh, what's going to happen now? Am I going to be able to, continue to do what I'm doing? But that's been really, it was really important for me to do those things because I wanted to be able to serve a variety and a diverse set of people.
Most of my clients don't have insurance, and so it's self-pay, and I make a payment arrangements, so they pay as they go. For the evals, they make several payments, and I am touched by how much they work to be able to afford an evaluation, and how honest, and they just, can I bring you another $50 next week? Sure, or not. So I have to do self-pay because otherwise, the Spanish-speaking population, most of them don't have insurance. My office is on the east side, and I have a story of a lady that I saw that came from Jackson Hole for an evaluation. And I met him in the morning because she could only come on Saturdays, and we planned to test all day. And then, so she came with her husband, and I said, so how are you guys? Did you find the hotel, my office well? Do you have any difficulties? And they said that they tried to go to a hotel, but they didn't know that the hotels don't accept cash, and they didn't have a credit card. So they resorted to park in the parking lot of my office building, and they spent the night there because they came the night before to be able to be rested. So I went, and they brought me a plant. So those are the kinds of things that you don't see when you work with other populations, and I, every now and then they bring me some gifts. Plants or something at the end. So that's my experience.
I'm not in private practice, and my office is in an ivory tower. And so, I think about sort of the translation of some of the stuff that I do to be actually useful to the communities that I work with. And so part of that is becoming a community engaged researcher and going into communities rather than waiting for folks to come to me. And so I do a lot of research in the schools related to how kids think and talk about identity. And one of the things in terms of access, so I'm not providing clinical services to students in the schools, but what I hope that I'm doing with my collaborators is that we're giving them some knowledge. So in 4th and 5th grade, we're talking about things like racial microaggressions, things that women of color eventually, hopefully, if they make it into seeing a counselor, will have a lot to talk about. And so what if we started earlier with kids and shared these ideas with them? And so when we broke down this sort of idea of racial microaggressions with a 4th grader, they got it. As soon as we, took the jargon away, they understood, oh yeah, that happened to my mom, that happens to me, that happens when I go in a grocery store. And so all of these experiences, are so visceral for them. And so, providing them language around their experiences, I think, is really important. And then so someday, if they decide to go and see a therapist, they can say, so I experienced a racial microaggression the other day on the bus, and so it was really messed up. So that's my hope sort of down the line when I think about the ways in which we, I guess, arm our kids of color. Yeah.
Thanks. And then to follow up on this again, you all talked about sort of the way you work with the community, particularly with folks who are marginalized. What sort of impact does that have on you and your business, right, or your work? Because the commitment can be there, but it can still be hard, right? So can you talk a little bit about that?
For me personally, I think it's very rewarding. Are you talking about? Well, yeah. For me, it's just rewarding. There are some challenges. I think. I was wondering if you were talking about challenges. I think maybe some of the challenges are with when we're trained, we're taught, boundaries have to be very firm, and we're taught that, gifts are not okay. But if gifts are part of the culture, and it's a very big part of the culture, like one of my women of color clients, she brings me like zucchini, or she'll bring me, from her garden, or she went to Thailand, and so she brought me a gift from Thailand, and gift giving is such a big part of the Asian community. You go visit your family, you bring fruits. You go visit, your neighbor, and you bring, some cookies, So it's such a, and they're not big gifts, and they're not, but they're little gifts of like, I appreciate you, or, just thank you for being, whoever, a friend, or, so I think the boundaries tend to shift a little bit, and also, with, I shared earlier about, self-disclosure. I tend to self-disclose a little bit more, and for me, I only self-disclose, and this is what we're taught to, is if you think that it's going to be helpful for the client, for the patient, and so many times I will self-disclose a little bit more because because I think it's helpful for them. But it is very rewarding for me, because for me, I mean, it's just rewarding for me to see progress, in any of my patients. But I think that I feel as if I'm like providing an extra, I don't know, me being a woman of color and their being a woman of color. I'm providing them with an extra layer of understanding, an extra layer of care that they aren't able to get elsewhere. And for me, that I wasn't able to get when I was looking for a provider. So I've always found it very rewarding. And I don't know why, I've been in my private practice for 6 years, and it hasn't been until recently, maybe until the last year, that I've actually been getting more women of color in my practice. Prior to that, I didn't get very many, and I wonder if it's just the younger generation growing up. I'm not sure. I used to practice in Boston. I was in Boston for about 7 years, and I worked in a community health center, and there. I saw, when I was there, the people that I saw were generally sicker. They were people who were kind of sometimes required to be there, but they generally were sicker. And I did see a few younger clients, and they tended to be sicker too. But the clients that I'm seeing now, they're kind of the run-of-the-mill, college student or young professional just struggling with just identity or anything like that. I feel a shift in the last several years, a shift in willingness of women of color to come into therapy.
I lost track of the question, but
Challenges that come from serving marginalized communities.
as I said, I think being able to pay for therapy is the number one, and so it's very rewarding to be able to help them and provide reduced fees for evals. I'm shocked when they tell me that another psychologist or other psychologists in town wanted to charge this much, which is like a huge amount for an evaluation. And I go, how can anybody pay that out of pocket? In addition to the fees that they're paying for their lawyers and how much they're working. They tell me, they're working 7 days. The husband is working 7 days a week, 12 hours a day to be able to afford the pardon process. So it's become increasingly rewarding personally to be able to come up with a payment schedule or a fee that it's reasonable for them and for myself. And some of the things that you said, Lee, started thinking, reminded me of my work in the schools, because I feel that there is bias there as well. For instance, you may have a student, we call them English language learners in the schools, and there is a lot of hesitation to conduct a more comprehensive evaluation when they may need it because of the difficulties inherent in the evaluation, like accessing an interpreter. So I have found, for example, a student, sometimes I'm called to consult, and I think the student may be in the autism spectrum, yet the team may want to go with something more superficial and quicker and easier to do. And therefore, that has resulted in the under-identification of students with second language backgrounds in several categories of special education. And I think that's also, it happens nationwide. So it's been my challenge and my effort to advocate and say we need to do as comprehensive an evaluation as we would do for anyone else. And we have resources, we have ways to bridge those difficulties, interpreters or working with families to get, good background information.
One of the things I struggle internally with about being a woman of color psychologist, and I keep kind of mentioning location and where I am here in Salt Lake City and in Utah. I sort of wrestle with one. I have, folks in this room today that I'm looking out and I'm like, thank goodness they're here. That gives me energy and support, and I don't know how I would do it without them. And so there's that idea of like positive marginality, and that's a term that I've been really trying to focus on. Like there's positive pieces to being a woman of color, and for the most part. And then there's this other part of it, which is there's just a lot of hidden labor for women of color. And it's all behind the scenes. Things like lots of service.
Accepting lower pay.
Yes, lower pay, extra service, and being emotional supports for other people of color. And, when we find each other, we gravitate toward each other, and it's wonderful. It's just, it's powerful, it's empowering. It's powerful, and it fuels me. And at the same time, the reason why we need each other so much is because we're sort of oftentimes isolated. And when we think about sort of therapy and multicultural counseling in particular, for me, it's, multicultural counseling for a lot of folks when they receive that kind of training, it's this sort of add-on piece, this additive, or, I took a multicultural counseling course, and so now, I can work with folks from diverse backgrounds. And for therapists of color, it's not an additive, it is just intrinsic to who we are. and it's so personal. And so every time even if we're working with, if we're working with another client of color or a white client, our identity and our race is just at the foreground all the time. And I wish that there were times where I could push it to the background, where it didn't have to be the centerpiece of my work. And so, and I'm proud of that aspect of my identity, but I get tired, get really, really tired. And I'm able to sort of feel the shift a lot because I grew up in Hawaii. And so for me, my early socialization and childhood experiences have been around people who look like me. And there is such a freedom when you grow up with, and you're reflected everywhere, from your teachers to people at restaurants to your political leaders. I go back often during a time when it's election season, and then you see all the signs, the yard signs, and driving in Hawaii, everyone has there are a lot of Asian last names. Polynesian last names, and there's just like, wow, these are my leaders, and so I don't have to think about it as much. And then as soon as I get off the plane, when I come back to Utah, I think I put on some armor, and I'm reminded that I'm not there anymore. It's like that, I'm not in Kansas anymore, that Dorothy says, in The Wizard of Oz. And so, and I don't realize how exhausted I am until I'm I'm back, I'm out again. So yeah, I think it's very layered, it's complex for me, and I know a lot of other people of color, women of color, share that experience of breathing in different spaces. Yeah.
And then how do you all manage that? Fatigue, exhaustion, isolation?
I reach out to folks who get it. I write. I find other things outside of work to put my energy into. I read a lot. As much as social media is just kind of bombards me and can be overwhelming, it's also a place where I can kind of have virtual support. I go to certain conferences where I see myself reflected and my ideas reflected, where I don't have to explain myself. These are some of my self-care routines.
I think I get more frustrated than fatigued for some reason, and sometimes when I find barriers or attitudes or behaviors that I cannot change, then it's like then I lose some hope and try to find ways to be revitalized in the effort and continue. But in the schools I work with children, so that's another source of nourishment, which I really enjoy. And I was also, when we first came before, the conference started, I was sitting at a table, and then Lee came, and then we chatted a little bit, and then she brought me some lemonade. And I go, oh my goodness, how wonderful. That doesn't happen very often, I guess, in I don't know, in the real world. And I wow. And then we kind of hug when she came, and that's something that I miss. And like she says, you kind of learn, like normally my body, when I greet someone, goes to give a hug or a kiss, but then I find myself, because the other person is standing stiff, and they worry more about the boundaries, or I don't know, the too much proximity, personal space. And so we have learned to sort of change our nonverbal behavior and proximity. And I guess the other thing I wanted to say that I found a lot of comfort in friends from other countries. I have wonderful friends from Iran. And having grown in Peru, I would have never thought that I would, there would be so much closeness with, Peru and Iran. And there are so many wonderful areas of intersection that I felt very supported with the friends that I've made from, like you said, I don't know what label to use, but it could be Russian, or it could be Vietnamese, and we find, much more commonality than I find maybe in mainstream culture, it continues to surprise me. But that's nourishing to me.
I find a lot of nourishment just from my family. I did my PhD here. I went to Boston for internship, and I stayed for a postdoc, and then I got a job as an assistant professor. But I needed family, so I came back. It's not a decision that I regret at all, but that's where I find my nourishment is I have my siblings here. And I think I'm extra close to my siblings because I wasn't raised by my family, by my parents. I was raised by my sisters because we were, I was a refugee, or we were refugees, and so my siblings, older sisters raised me. And so we, all of us live here. And we get together quite a bit. And so for me, that's where I get my nourishment. My kids have cousins to play with, and they have aunts and uncles that watch out for them. So for me, that is what that's really important for me.
Thank you. Just to change the subject slightly, we also wanted to talk about the need for diverse providers in mental health communities. So would you all talk about some of the unique talents and wisdoms that you think diverse providers provide to communities?
Can you repeat the question?
What are some of the unique talents and wisdoms that women of color providers have that may not be seen in other providers?
Go first, Karen.
This is a good question. I'm not doing that much clinical work right now, but I can talk about it more sort of broadly. And from the different organizations that I've been a part of, and I see folks who are here, I think diversity, providers, having diversity among providers is critical for any community. When we have sort of this homogeneity of thinking and practice, we really, really disadvantage our clients. I've been to a number of different organizations and gone to different type of continuing education and been able to meet other providers who just think differently from me, and that has expanded how I've thought about my work, my research, my practice. I just sort of think a lot about kind of going to this kind of research anecdote. When they first developed the mouse, they only had right-handed folks on the task force to develop the mouse. And so it wasn't until a left-handed person entered the room and realized that this mouse won't work for a big swath of the population. So I was, think a lot about that. What are we missing whenever we think about providing services? What stories not being told? Who are we not including at the table? And not, I kind of been talking from this sort of professional perspective, and I really believe that doing as much stakeholder type of conversation where it's not just the providers saying, this is what I think my clients need, again, sort of operating from that paternalistic and perspective, but having clients tell us, what do you need? What's missing? What are you not getting? What's your experiences like? And I think we're doing a little bit more of that, but we have a real long way to go, especially with therapy, because we don't have a lot of tools in order to evaluate multicultural competence. That's my area of research. We all have these aspirations to be multiculturally competent, but when we ask folks, what does that really look like? We have about 1,000 different answers. And which is great. I mean, back to sort of the idea of diversity of thinking. But at the same time, I think it's about time for us to start really getting specific and drilling down to think about how does having a strong multicultural counseling experience and backgrounds impact treatment outcome. More than just, it's great that, they consider diversity, but how does that really look in therapy? So that's where I hope we move as we start expanding our therapist community, and yeah.
Well, again, taking the term women of color broadly, for me, being able to communicate in Spanish makes a big difference. I truly think that clients feel very comfortable, and they report hating having to go through an interpreter. But it's not enough. I mean, just being able to speak the language. And then, I've had clients from, let's say, Uruguay that are very different from clients from Mexico, or clients that are from Lima, Peru, where I'm from, as opposed to a client that may come from the mountains of Peru. So within myself doesn't mean that I am very equipped to, or quickly, readily to treat anyone just because, I speak Spanish. And so I have to, consult and reflect and understand to be able to see, that worldview of this client. Because it's definitely, it's not everyone. I mean, as we all know, we cannot put people in the same bag just because they are of color. There's so many complexities, so many differences that you have to remind yourself them to keep remembering that.
When I was in graduate school, I'm trying to think if we even had a class in multicultural psychology. I think maybe we had one. Diversity of thought is so important. And I don't even think that was really something that people thought a lot about. Maybe they thought a lot about it, but they, as a psychology, as a student, it wasn't something that I think we talked very much about at all. And most of the professors that I had probably were, I wouldn't say they were very diverse either. And it wasn't until I went, and neither was the student population, honestly. So it wasn't until I went into on internship that I learned about what my eyes were just, whoa. I went to Boston to the multicultural training in psychology. And their purpose, so we had, every year I think they really try to have a very diverse group of interns. And so in my year, there were 7 of us. There was 2 Asians, 2 African Americans, 2 Latina, and 1 Jewish male. And we would have these really tough discussions every Thursday. I remember all day. It was my favorite day, but it was a really emotionally tough day because they would bring in topics, and we would talk about racism, and then about stereotypes we have about each other, and so it just really opened my eyes. This whole year we taught, and because I came from very white Utah, I actually didn't know very many other minorities, and so for me it just really opened my eyes to, and I was in Boston, not in Salt Lake City, Utah. The diversity that I knew here was my family, right? So I think the diversity of thought and perspectives and is just so important. I learned so much on my internship year, and those people that the interns are the earlier question about who do I go to when I have when I need nourishment, I go to those people too. That was the first time I ever had a woman of color for a supervisor. I still reach out to those 3 women that I had during that year. So yeah, that's another avenue of my nourishment, is I reach out to those folks. And what do I miss in Boston? That cohort and those 3 faculty that that means so much to me. They taught me so much. I think diversity of thought, and I really hate to think that I'm like, just because I'm Asian, I can treat all the Asian women out there. That just doesn't work. So if we can get more people of color, women of color in this profession, that would, I think that would make us, I think it'd make the world a better place.
So I'm going to change the subject again to privilege, and ask you all to talk about how a therapist's privilege might affect a client and a client's course of treatment.
I mentioned earlier, maybe I didn't, maybe it was just in my head, I was thinking about this. So every interaction is a new interaction, and so I might meet someone who shares similar demographic and identity statuses as I do. And so at first blush, visibly, there's this connection. And I think it takes a little bit more work sometimes to dig deeper into experiences and other identity statuses. I was in a workshop a couple weeks ago, and it was just with Asian and Asian American counselors and psychologists. And we were talking about skin privilege, for example. So my experience as a woman of color will be very different from your experience as a woman of color in Utah. And being East Asian, that's a level of, while there's lots of discrimination against Asians and Asian Americans, there's still a different kind of privilege in the places in which I am accessed and able to go in and out of without very much distress. That's a privilege. So if I meet an African American client and I cannot even begin to imagine that our experiences are the same. And so thinking about that piece, of course, class privilege. I grew up middle class. Both my parents have graduate degrees. Earlier this morning I was talking to my partner about how my son, who's 7, said to me yesterday, hey Mom, you know what an idiom is? I'm like, yeah. And so he starts naming all these idioms like bent over backwards or on the fence or caught red-handed. And so I started thinking a little bit about privilege, language privilege. So these are idioms that we kind of just sort of, for those of us who born and raised in the US, and this is part of our lexicon of the way we talk, it's a privilege because we understand the nuances of conversations that some folks don't. And so earlier when Alicia mentioned discrimination based on accent, those are things that I have to consider, that I speak standard acceptable English, which is a privilege. So there's so many layers to think about, and I think about quadrants. I've been doing a research, so I always visualize like, what would that look like? I'm in this quadrant with this person, and I might have this have this privilege, but oppressed here. And but I think at the end of the day, just sort of my day-to-day interactions, I realize that we're constantly shifting, and each interaction is transactional. So what I say to one client might land okay based on our interaction, and then with the next client, it wouldn't land okay. And so just really, really being conscious of that, and typically it's through nonverbal behavior, not so much people, not so much someone saying, hey, that was oppressive, or I'm offended by that, but really thinking about paralinguistics. And for me, one of the cues where, when I'm uncomfortable with, and there's some kind of privilege oppression tension going on with me and a client, or me and someone else, is I have some sort of verbal and behavioral tics that come up. And I'll share one of them with you. Is when I'm uncomfortable and I realize that I might have more privilege, I start to overcompensate and start to almost be ingratiating and saying, oh, you're so impressive to me, and oh, I'm just so amazed with your resilience and your ability to kind of get here. And I mean, internally what's happening is really I'm uncomfortable with my privilege. I don't know what to do with it, and so I overcompensate. And that's just one. I've been sort of trying to become more and more aware of my other one. I think the other one is like doing some psychoeducation or talking too much. I mean, so these are my cues of when that dance of privilege and oppression start happening. And so it's always, and they always come when I least expect it, and every day is sort of a new learning experience. Yeah.
I grew up also, my father was an accountant. He had a really good job. He became a CFO of a government big company. And so I think the biggest fear that anybody growing up in Peru have is to be poor. And so you want to pretend, you want to distance yourself in any shape, way, or form that you can. How you speak, how you dress, your costume. That's why I think I come to the realization you want to dress, Latinas, dress nice, because you want to, show that you are not poor. And with that, I find my biases when I feel my privilege, as you said, and you said it so beautifully, and my efforts to try to, no, I'm not feeling that way, but you are. And it's hard to deal with. It's very challenging to deal with when you see the realities. I mean, although, which I enjoy, I guess there's many commonalities, but you can see extreme differences in the opportunities that I may have had growing up in Lima, and the challenges that the families and clients that I work with have.
I'm thinking of my own privilege. I mean, I guess, like Karen, my English is standard. I don't have an accent, and I think about my practice, and I think when people, I'm listed, and in Psychology Today, and there's my picture, and my name is obviously not, standard American name, but I think some people are surprised when I answer the phone, and is this, I'm looking for a doctor, and they're like, oh yeah, this is, she's speaking. But I think that they're more likely to see me because I don't have, an accent.
I need a secretary.
Yeah. And so I think, we haven't said it, but there is this, I think it's a double-edged sword, but there is this, model minority. I'm Asian, I'm model minority, so they expect me to be smart, and they expect me to be, all these things that I may or may not be. But I think, that's definitely, if I'm thinking about privilege, that is privilege compared to, maybe, like your last name compared to my last name, of course, there's always, I'm heterosexual, and I think when I work with clients that are not heterosexual, there is that privilege, that is very clear, and like just in the political dialogue today. But I'm certainly aware of the privileges that I have, and And yeah, adding to all the other things I'm thinking about when I'm trying to do therapy, about what is therapeutic, that is something that I keep in my back pocket as well. I don't want to be acting on any privilege that is, and actually, and sometimes sometimes that comes up in therapy too. I think if it's very present in the room, it has to be addressed, and so I do.
And so can you talk about the relationship between oppression and mental health, specifically related to women of color?
Such a broad question.
Going out.
Yeah, it was really big. I had a really wonderful opportunity recently to see Michelle Fine speak, and I don't know if any of you have ever heard her speak or read her work, but I love the way she talks about, I'll focus on one in particular, so racism. And we think about it as this social issue, this psychological issue in terms of how it impacts the way people relate to one another, so it's a relational piece. But something she said that really struck me, and I've been thinking a lot about it as well, is how it lives in our bodies. And this idea that for women of color in particular, so every day, I mentioned sort of wearing armor and then taking it off, and then sometimes feeling like we're, carrying that armor is just so exhausting, so I want to take it off, and then saying, with this person, I'm going to, trust you, because I think at a really core level, people just want to connect. And that's no different for anyone, that as humans, we want to connect. And I think, but for people of color in particular, there's a lot of complexity to that, especially in the US. There's always this sort of healthy suspicion, I call it. Not I call it, it's not my term, but healthy suspicion around wondering whether or not, I can trust that person, and if I share some of my personal vulnerabilities, will it be used against me, and maybe not intentionally, but later used, and so then that's just, it's taxing on people's bodies. And oftentimes I think because of the stigmatization of mental health, seeking mental health treatment, there's a lot of somaticizing, I think, that happens, and not in a pathological way, in a very real way, that it is felt in our bodies. So whether it is headaches or insomnia or chronic pain, that is, related to mental health. And so I think that more and more we are seeing that intersection happening around racism and sexism and physical health, and that it is not neuroses, that it is not in our heads, that it is real. And I don't know, maybe I'm speaking out of both sides of my mouth, but at the same time, maybe unless we are able to show you visibly that it is affecting us, physically, then until then it's not legitimate. So I think when working with, I even forgot the question, sorry, but I hope this is still on point. So the idea of when working with women of color in particular, thinking about the various ways in which experience shows up. And it might not be through our verbal expression or maybe even psychologically, but in many other ways, relationally and physically.
Let's see. In the stories that I get from my female clients regarding sexual abuse that they never disclose to anyone, I feel the effects of oppression, because their families, their parents never allow them to ever talk about it again. It's over, it happened, what's the point of bringing it up? So their question is it okay that I can even say it? I don't, or themselves, can I don't want to talk about it. And then I keep pushing a little bit, and tears come out, for 20 minutes, because we have situations that have been, kept deep inside for 20 years. And then, something that you reminded me, somatization and malingering. I also have the opportunity to do some neuropsych evals for Spanish-speaking clients, and it surprised me at first when I started doing this line of work that they were not passing the test of effort. They're pretending, I guess not probably with the purpose of, fake, but they do not understand their own symptoms, and they feel that, I don't remember, I don't know. And typically on tests of memory, where they do very poorly, lower than you would expect. And so I found out that many of them really, they are somaticizing their symptoms, because that's the only angle, the only way, the only valve that they have to express their discomfort and their pain. And it's not well understood by other clinicians, because they feel this person is purposely malingering for the sake of obtaining money. But it's much more complex than that.
I guess I think about my own experience as a woman of color, and I'm a mother of 3 children. I'm a wife. I'm a business owner. I'm sister, and I think in all these roles, I think. Just earlier you were talking about how you have to shift, and I think that's a form of oppression, that you can't be who you really are. You have to, and there's so much pressure for me to be like a mother in this, a mother that fits, what a white society expects me to, be. And then when I'm, with my, family, I'm expected to be like this, and so I think, I don't know, I think there's a lot of stress that is associated with needing to switch, and you're expected to be so many different things, and I know that I know that just women are expected to, women in general are expected to be lots of different things. But I feel as if I have like another layer on top of being a woman. I have to be a woman of color in this situation, and a woman of color in this situation, and you're just a woman in this situation. And so, there is this extra layer that I feel is that is expected of me. That I think is a form of oppression.
So we have about 10 minutes left, and I'm wondering if you all have any questions for the panelists? Yes.
Okay, so having recently moved to Utah from a very diverse place, I have found myself so many times in a conversation with someone where the person I'm speaking to is really uncomfortable that I'm using the term person of color, or that I'm acknowledging that maybe, I don't know, that I'm pointing out, that I'm talking about race, basically. How do you, because the way I handle this is first of all, I internalize it, and then I say, oh, maybe I missed something, let me give them the benefit of the doubt, and then I overthink it, and then I don't know, either I lose a friend or, you just like push it down or whatever. So how do you guys deal with that in a professional or in personal environment?
Oh, repeat it for the video. So I was listening more than listening to repeat. So how do you all, Can you say that again? Yeah, sorry.
How do you cope with someone who is uncomfortable with even acknowledging race or racial differences?
Okay. So the question is, how do you deal with someone who's uncomfortable with race or acknowledging racial differences?
You know, so I'm going to give credit to Uma. I've been doing this more often because I've been given the language, you know, in the therapy room. What is it like to sit with me, a woman of Asian descent? Because I think sometimes that comes up and they have questions about it, or they have, so often it's duh, you know, that you're sitting in front of, you know, your therapist isn't white and, you know, she's a woman. So, and I think sometimes by my being the person who brings it up, it gives them permission to ask questions, or it gives them permission to talk about what it's like for them. And so I think I have found that to be quite helpful. You know, that's in the context of therapy, and I'm not, you know, suggesting that you go in front of, you know, somebody new and say, hey, I'm a woman of color, how do you feel standing in front of me? But I think in the context of therapy, I think it's been helpful just to put it right on the table.
Well, I think that dynamic, I mean, it happens almost always, and I mean, and I think you get tired of, you know, like raising self-awareness or self-disclosing. So I think to me, you know, like self-disclosing that I feel different, that I may feel uncomfortable, that I feel like when the accent issue comes up, not necessarily in practice, but, you know, with neighbors, for instance. Or, you know, where are you from? And I've been here longer than them, maybe 30 years in Salt Lake. Oh my goodness, that bothers me so much. And I go, why does it bother me? Because people keep perceiving me. Maybe I want to blend in. Maybe sometimes I don't want to be perceived as, you know, as a woman of color. I want to be part of the flock. And so it is, you know, I think, yeah, living here in Salt Lake, constant that it comes to you, even if you don't, you know, like, no, that you have to address it, and some self-disclosure I think has helped me, you know, like to address, and then for them to understand how I may feel.
For me, I think it depends on the relationship I have with the person that I'm having a conversation with, and my energy level, and whether or not I have the energy to get into it. And so I've become more and more judicious around those kinds of conversations, because I think when you engage another person in those conversations, it is a gift that you're giving, and that sometimes, as we know with gifts, someone might not be ready to receive it, or they don't see that a gift is being given, and so that just sort of thwarts that conversation. But if it's someone I really care about, I start there, and you know, I say things like, you know, I really care about our relationship, and I feel like something is getting in the way, and it's really around when we start talking about issues of race. I notice whether it's defensiveness or you know, whatever it might be, that reaction. And saying, you know, I value our relationship and I want for us to go there. I want us to have this kind of dialogue. But I can't unless we are able to sort of begin with that connection and you noticing that this is important to me. So that has been helpful. Another concept that's been really helpful for me is calling in. And I can share that with you later. You might already know about it. So it's this, it's sort of the parallel to calling out culture. So in calling out culture, where you see something racist happening and maybe it's in a public forum, then you say something out loud and you call attention to it so that you can disrupt that behavior or action. And it's very useful at times, but it doesn't necessarily further a conversation. It just stops the action. And calling in is more a relational tool that allows more dialogue to happen and relationship building to happen. So I guess kind of circling back, it just depends on who it is. And so I'll use maybe different tools depending on that.
So what solutions or strategies are there to get more women of color, people of color as therapists?
It's really hard. Application season is coming up at the U, and there are a lot of misunderstandings, I think, around, and probably some myths around. I'll speak to Utah specifically and Salt Lake City specifically. I mean, I had them. I had a lot of stereotypes about what it would be like to be here, and I have just been consistently surprised and challenged by my stereotypes have been challenged a lot. And it's very tricky to recruit students. I think part of that is, I'll speak from folks who do a lot of the training, and there are other folks in the room who can speak to this as well. That access to education and training, we think about, someone who, anybody can apply for our master's program in school counseling or clinical mental health. Anyone can do it. But I think therein lies a problem, that we need to start way, way, way earlier. My argument is that we start as young as elementary school. We start talking about mental health earlier in ways that are developmentally appropriate, and sort of sharing this as a career option. Because if we think more sort of downstream, we have to think more upstream, like what's happening in terms of like things like this. I hope that there are folks in the room who might be considering a career in mental health, and that just by having some shared experiences and being reflected, it's really, really important. I know as faculty, we're hiring a new faculty person, and it's super important for us to consider how do we want to grow our community, our academic community, and that means really trying to recruit folks that have diversity of thought, and so starting earlier.
I completely agree, and working in the schools, I think that will be a wonderful initiative, yeah, let's do it, yes, yes, because I am in Salt Lake, yeah, IRB and all, yes. And then again, just reflecting on why I ended up in psychology in Peru, and I think I remember as a child that we had a friend who was a psychologist, and I remember my mom and my dad saying, "Oh, psychology, that's such a cute career for a girl, isn't it? Cute career." And I think that I go, "Oh, that's acceptable for my parents." And later on, I felt that I was drawn into, so many questions that I did not find answers to growing up, and the things that I witnessed and what I went through, and so. But it would have been awesome to have, that support early on, and I think intuitively I could see, disparity and injustice, and that sort of triggered me to try to to do something about it. But again, going back to privilege, you know, even going to school, I mean, graduating from high school can be, I mean, so tough for many of our students.
When you asked the question, my immediate response in my head was like, well, we have Karen, you know? But of course, then she says, you know, of course you have to start even younger than that. And I said, yes, that's great, because now we have Alicia, you know? So there's hope, right? There's hope. There's more than, I mean, I keep going back to my youth in Utah, you know, when I was young. There were not that many people of color in Utah. And so so, you know, I'm so happy that we are more diverse today than we have been. You know, I don't. So it's great that we have people in education, because I think it starts in education. But it also, you know. So what have I done personally? My children have like a career day, right? And so they ask parents to go in. And so, you know, I take the day and I go talk to, you know, 1st through 6th graders, you know, about, you know, what it is to, how it is to be a psychologist and what we do, and, you know, and for me, it's important for them to see that I'm a woman, you know, I have daughters, and I want them to feel like they can be able to be successful, and, you know, and I'm a woman of color, and so I think it does start young, and, you know, when the opportunity arises, you know, I do things like that.
So unfortunately, we've run out of time, but I think there's a 15-minute break in between the panels. So if you all would like to engage the panelists in, on one-on-one, you could certainly do that. But at this point, I would really like to thank Karen and Alicia and Lee for talking with us about these issues around women of color and therapy. And I really enjoyed listening to you. I really did. Thank you. Thank you.